What's going on, everybody? It's your boy GDQ. I felt like this video is extremely important to make because there's a lot of misinformation and misconceptions going on about whether or not coronavirus is airborne or not. And the short answer is yes. And I'm going to explain why throughout this video. It's kind of difficult because the experts, people like the WHO, even posted on Instagram a few days ago that coronavirus is not airborne, which is kind of completely false and totally makes people draw conclusions that are not true, and it's completely their fault. So throughout this video, I'm kind of going to explain my research of why it is airborne, and whether or not you should be taking precautions when you go out in public, like wearing face masks. So I'll start off with this conference from February 11th, where the WHO director comes out and says that, yes, the coronavirus is airborne.
Ebola and this are not the same. Ebola is lousy. This is airborne. Corona is airborne. It's more contagious.
Okay, so I'm going to start with some language and definitions because for some reason, I don't know, people don't like to go through that. So we'll start with the kind of the Wikipedia definitions. It's easiest for all of us to understand. I'm not an epidemiologist. Most of the public is not epidemiologists. So it's kind of difficult to understand, so I don't really blame people about not really knowing what's going on. So Wikipedia states that airborne infections usually occur by the respiratory route with the agent present in aerosols. So that means that they're infectious particles less than 5 micrometers in diameter. Now, the WHO kind of changed their stance, and this was posted on March 29th on the WHO website, and it's a scientific brief, and they make this conclusion where they say, WHO continues to recommend droplet and contact precautions for those caring for COVID-19 patients. Okay, so we're gonna define things, okay? So droplets are infectious particles that are greater than 5 micrometers in size. Airborne or aerosol, now that this type of disease, these particles are less than 5 micrometers in size. Now, coronavirus, SARS-CoV-2, the virus that causes COVID-19, is 0.06 to 0.15 micrometers in size. So these infectious particles are small enough to be considered airborne or aerosol infectious particles. Now, so the WHO, though, is recommending that people take droplet precautions, which means that for this video, we're going to consider droplet transmission to be particles that are greater than 5 micrometers in size. And for airborne/aerosol transmission, which for this video we are going to consider to be the same thing, the transmission is particles that are less than 5 micrometers in size. And just for reference, the SARS-CoV-2 virus is 0.06 to 0.14 micrometers in size. So it does meet the criteria of possible airborne/aerosol transmission just based on particle size alone. So now we'll go on to the second sentence here. It says, WHO continues to recommend airborne precautions for circumstances and settings in which aerosol generating procedures and support treatment are performed according to risk assessment. So they're completely contradicting themselves right here. They're saying that they're recommending droplet and contact precautions for people caring for COVID-19 patients, but they're saying to take airborne precautions when there's aerosol generating procedures. Okay, so first off, that's completely confusing. It doesn't say anything. So if you're saying that it can be aerosolized in certain circumstances, why aren't you just saying take airborne precautions? There's a few reasons why, obviously, that they're not doing that, and then so I'll get into that later. But this right here is super important because this was from April 1st, 2020. This is a rapid expert consultation on the possibility of bioaerosol spread of SARS-CoV-2 for the COVID-19 pandemic. This is an expert basically telling the CDC that they need to start taking airborne precautions. Okay, so this is April 1st, 2020, but we've known that SARS-CoV-2 is likely aerosolized way before this. So I'll continue with that later on. But they go in here and they say currently available research supports the possibility that SARS-CoV-2 could be spread via bioaerosols generated directly by patients' exhalation. This means that you could be breathing and you could most likely be spreading SARS-CoV-2. Okay, so they say a recent study of SARS-CoV-2 aerosolization at the University of Nebraska Medical Center showed widespread presence of viral RNA in isolation rooms where patients with SARS-CoV-2 were receiving care. They collected air and surface samples from 11 isolation rooms that were used to care for patients infected with SARS-CoV-2. Okay, so this study found that they were able to identify basically aerosolized particles of SARS-CoV-2. Okay, so this is his name's Harvey Feinberg. Okay, this is the Standing Committee on Emerging Infectious Diseases and 21st Century Health Threats. Look, this guy is basically telling the CDC, like, hey, this is aerosolized. You guys need to make sure that you tell everybody that it is. Okay. We're going to go here, and I'm going to pull this up. This is from February 6th, 2020. Okay. Look, this is a correspondence produced by the Lancet. Now, they say on January 22nd, a member of the National Expert Panel on Pneumonia reported that he was infected by 2019 nCoV, so that's COVID-19, during the inspection in Wuhan. He wore an N95 mask, but he did not wear anything to protect his eyes. Several days before the onset of pneumonia, Wang complained of redness of the eyes. Okay? So this is saying unprotected exposure of the eyes to COVID-19 in the Wuhan fever clinic might have allowed the virus to infect the body. They say right here that, look, severe acute respiratory syndrome coronavirus is predominantly transmitted through direct or indirect contact with mucous membrane in the eyes, mouth, or nose. That's like touching your face, okay? But they say that people should be wearing protective eye gear, okay, and that's to protect you from touching your face. But this guy is basically saying that it's likely aerosolized and that you can just get it walking through places. Okay, so this isn't just droplets, this is airborne. This right here, another expert in China. This is from February 2020. Okay, this is probably the most important figure that I could present the whole time. This goes into like a person likelihood of transmission. So bodily contact fluids, right? So that's being right next to someone. We already know that. That's basically how all diseases are spread, right? And then, so here we go. We've got droplet right here. Okay, so they say that, you know, it's less of a chance through droplets, and then fomites, which means like it can basically kind of travel further and stick to surfaces. And then they even come out and they say that it can be transmitted by aerosol. Okay, the virus can be transmitted if someone was exposed to high concentrations of aerosol in a relatively closed environment for a long time. Okay, but they're saying here that the aerosol transmission happens conditionally. It happens conditionally, but it doesn't matter because it still happens, right? So that means that it happens. This is most likely in places like hospitals. So now there's a lot of hospitals. I know there a lot of reports that hospitals are not letting their staff wear masks, which is absolutely ridiculous, because in a perfect world, your patients and your medical staff are wearing masks. This is going to protect everybody. Okay. So, but the problem is that our medical care workers have been getting extremely sick from COVID-19. And so if the aerosol transmission happens conditionally, it can happen. So they should be taking airborne precautions like it's the flu. Okay. Everybody should be masked up. That's the thing. But I don't know. It's crazy to me. Now this right here, Mr. Wang, he works at the Department of Infectious Diseases at the Peking University First Hospital in China. Okay, they put out this. There is possibility of aerosol transmission in a relatively closed environment for a long time exposure to high concentrations of aerosol. That means if you're working with COVID-19 patients, you are likely being exposed to aerosol particles, which means that you can probably get sick from aerosol transmission of SARS-CoV-2. Okay? But here's the thing. It's really difficult. Science is really difficult because you've got these ifs, right? Respiratory droplets in close contact are the main routes of transmission, which means that most of the time, it's really hard because we don't have a lot of evidence on it yet. But most of the time, respiratory droplets in close contact are the main routes of transmission, which means that here, the droplets greater than 5 micrometers in size, that applies. So hospitals are taking droplet precautions, but there's still the possibility of aerosol transmission. So no matter what, this is my suggestion to the general public. Just think that it's airborne and it's transmitted through aerosols. That means that you could be in the grocery store and you can possibly be infected, not even by touching anything. Okay? I'm going to continue. I've got a few more things to show. So here's a study that was produced by the New England Journal of Medicine. This is basically like the study that everybody's going to right now for whether or not SARS-CoV-2 is viable in aerosols or on surfaces. Okay. SARS-CoV-2 remained viable in aerosols throughout the duration of our experiment, 3 hours. So they were able to find viable transmittable particles of SARS-CoV-2 in the air after 3 hours. After 3 hours, okay? The WHO, they had stated here that the aerosols were generated using a nebulizer and fed into a Goldberg drum under controlled laboratory conditions. So they're saying that this is a high-powered machine that does not reflect normal human cough conditions. I don't know if I mean they're kind of I don't know what to think of this. Okay, they're saying just because it was in a laboratory condition means that it might not be a proper study, which is absolutely freaking ridiculous. It's ridiculous. Okay, so now we're going to talk about kind of the fluid mechanics of coughing and sneezing. So this is recent, March 26th. Lydia, she is a scientist at MIT. She does a lot of fluid mechanic works. Okay, so she produced this experiment of coughing and sneezing and how far that cough or sneeze can travel. So let me play this real quick. Okay, we'll go back again. We'll go back over here and I'll play it one more time, okay? So this is someone sneezing, okay? So they sneezed right here and the distance 23 to 26 feet that it traveled. That was the sneeze, okay? That was a sneeze. That's crazy, okay? And these were viable particles over here, all right? So that means that when you sneeze and when you cough, it is traveling very, 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 very far, okay? Now, look, She states here, although no studies have directly evaluated the biophysics of droplets and gas cloud formation for patients infected with SARS-CoV-2 virus, several properties of the exhaled gas cloud and respiratory transmission may apply to this pathogen. If so, this possibility may influence current recommendations intended to minimize the risk for disease transmission. If look, the WHO is saying that healthcare personnel and other staff are advised to maintain a 3-foot distance. CDC recommends a 6-foot. Okay, this is saying that it could possibly travel 26 feet, people. 26 feet. Okay. So look right here. For these and other reasons, wearing of appropriate personal protection equipment is vitally important for healthcare workers caring for patients who may be infected, even if they are farther than 6 feet away from a patient. Okay. So we've already established that for healthcare workers, they should be wearing masks no matter what. They should be taking every single precaution, acting like they could get sick from this. I wear masks, completely PPE'd up, okay? And if for everyday citizens, even going into the grocery store, you should be wearing something. And I'm going to explain the efficiency of masks. Even if it's a bandana, that's not that efficient. We have to slow the spread in the transmission. This is the only way, or one of the only ways, that we're going to be able to fight the disease and kind of reduce the strain on the hospital system, okay? This is we're talking about the mechanics, okay? The mechanics of transmission of SARS-CoV-2. Aerosol emission and super emission during human speech increase with voice loudness. This was published February 20th of 2019, okay? So this says mechanistic hypotheses about airborne infectious disease transmission have traditionally emphasized the role of coughing and sneezing, which are dramatically expiratory events that yield both easily visible droplets and large quantities of particles too small to see by the eye. Nonetheless, it has been long known that normal speech also yields large quantities of particles that are too small to see by the eye, but are large enough to carry a variety of communicable respiratory pathogens. Here we show that the rate of particle emission during normal human speech is positively correlated with loudness of vocalization ranging from approximately 1 to 50 particles per second. Look, this is saying that even just breathing, it's likely that we can spread disease. Just breathing, okay? Right here. Despite their small size, micron scale particles are sufficiently large to carry a variety of respiratory pathogens such as measles virus, influenza virus, and Mycobacterium tuberculosis. Okay, and right here they say, indeed, recent work has confirmed that significant amounts of influenza viral RNA are present in small particles emitted by influenza-infected individuals during natural breathing without coughing or sneezing. Okay, we're talking about coronavirus. They're saying 50 to 500 nanometers. We already established that SARS-CoV-2 is 60 to 140 nanometers, right? So this definitely fits the definition of possibly being spread through breathing. Okay, this isn't a direct coronavirus study, but this is talking about the mechanics of things like breathing and coughing and sneezing, and the possibility of any of these viruses being transmitted through aerosols and being transmitted through just breathing. So this is possible evidence of coronavirus maybe being spread even through breathing. Now, the difficult part is to completely make conclusions, right? So the WHO is saying to take just droplet precautions and only airborne precautions in certain circumstances. My advice is for the public to understand that it's most likely and definitely, in my mind, spread through aerosol transmission, which means it's airborne, people, which means when you go to the grocery store, you should be taking precautions. And now it's difficult because coronavirus is novel, and science is always evolving. And so the thing is that if there's a likelihood of this stuff being transmitted through aerosols, why wouldn't we take precautions in every single setting that we can, whether it be grocery stores, healthcare facilities, anything like that? Okay, even the one person who's a trucker, you know what I mean? He should be wearing a mask too. Any type of thing. Why aren't we doing everything to present or prevent the transmission of the disease? That's the real question. So this is a article by Nature, and it kind of contributes to the just the confusing nature of media and science in general. Evidence from preliminary studies and field reports that SARS-CoV-2 is spreading in aerosols is mixed. Okay, so at the height of the coronavirus outbreak in Wuhan, China, this is another study. Virologist Qi Lan at Wuhan University collected samples of aerosols in and around hospitals treating people with COVID-19, as well as at the busy entrances of 2 department stores. In an unreviewed preprint, so it's preprint, it's not completely peer-reviewed yet, but he wrote the article. They did this experiment. It's most likely going to get printed. They found viral RNA from SARS-CoV-2 in a number of locations. So they were able to, find these particles that were aerosolized. It's the study doesn't ascertain whether the aerosols collected were able to infect cells, but in an email to Nature, Land says the work demonstrates that during breathing or talking, SARS-CoV-2 aerosol transmission might occur and impact people both near and far from the source. As a precaution, the general public should avoid crowds and should also wear masks to reduce the risk of airborne virus exposure. I'm just saying. I mean that speaks for itself. They go on to point out that in this study, there's another study where they found they took air samples in isolation rooms, and they basically found positive results, but the outlet was close enough to a person with COVID-19 that it could have been contaminated by respiratory droplets from a cough or sneeze. Okay, so there's just a different evidence, right? That science always uses the term likely. So if we're using the term likely here, it's likely spread by aerosol transmission, which means it's airborne, people. We need to be taking those types of precautions, and these precautions should have been taken long ago. Like I said, this one was, January 22nd. They were talking about a possibility through the eyes, and then what was this? February 20th. They came out and said aerosol transmission. And then on the 11th of February, which was before that, the WHO director had said that it's probably airborne. So they've known for a while. So let's go on to face masks. Should you be wearing a face mask or not? Should you be wearing bandanas or anything, right? So the thing is the California Department of Public Health just put out on the April 1st cloth face covering guidelines. So they're basically advising the general public that they should be wearing a mask, even if it's a bandana or cloth or t-shirt or a towel, anything. You should be wearing that in public. That is crazy. And what's crazy to me is that they've been not giving masks to hospital workers because of a shortage, and it's absolutely outrageous and freaking criminal. It's criminal. Okay, I have family members who work in healthcare settings who just a few days ago, last week, they were not allowed to wear masks. And now the Department of Public Health wants to come out and say that everybody should be wearing masks. No matter what you're doing in public, you should be wearing masks. It's freaking criminal, man. I mean, it took this long to come out and say that. I mean, it's absolutely ridiculous. And they're fighting whether or not for the CDC to recommend to wear masks in public. People need to be wearing masks, okay? I want to point out that some people want to talk crap and say that, if you're not wearing a certain mask, it doesn't help. And this kind of echoes this point from, what is this? This is from the University of Minnesota. And this scientist is basically saying that there's no scientific evidence they're effective, that cloth masks are effective in reducing the risk of SARS-CoV-2 transmission. They may result in those wearing masks to relax other distancing efforts because they have a sense of protection. So that's one. That's, to me, that's the big deal. Why they don't want to recommend masks. One of them is that people will reduce their distancing efforts. So we need to social distance, but and everybody needs to wear masks in public. This is a very different switch in our culture, in American culture. We don't wear masks, but that's going to change. I'm telling you right now. Everybody needs to be wearing them. And here's the other thing. We need to preserve the supply of surgical masks for at-risk healthcare workers. The thing is that they're not even supplying them to healthcare workers. I mean, they supply them to patients, but I mean, and they do it when, they're PPE'd up and they're going into an isolation room or something. But I mean, if you're a regular doctor, like a pediatrician, I mean, you should still be wearing a mask if you're seeing a kid for a normal checkup. That's what I'm saying right now. They're saying that it will not reduce SARS-CoV-2 transmission, but that's just kind of bad. It's a little bit bad to say. So I'm kind of upset that they're saying that. They're basically saying that respirators most likely will be able to reduce it. A non-fit tested respirator may not offer any better protection than a surgical mask. Yeah, blah, 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 blah. Okay, but here's a study that was done in 2013 that says testing the efficacy of homemade masks, would they protect in an influenza pandemic? And so this study basically found out that both masks, so surgical and cloth masks, which means even like a bandana, significantly reduce the number of microorganisms expelled by volunteers, although the surgical mask was 3 times more effective. So obviously the surgical masks are way more effective. Those the N95 and surgical masks are obviously what are being recommended now by the public health department, but they're saying you can wear anything. Okay. I agree with that. I completely agree with that. I don't care if whatever it is, we should start wearing masks in public. I haven't been wearing one. I'm gonna start wearing one now. I've made the decision. I have an N95 mask. I'll reuse it. And the thing is people, the government needs to get their shit together. They need to start producing masks fast. Everybody needs masks when they're out in public, and I'm talking good masks. Everybody should be using N95 because that's in a perfect world, right? But even if you're not wearing an N95 or surgical mask, please wear something. Wear a mask in public. Wear gloves. And let's take precautions that this thing is airborne. Okay. I hope this helps people. Please share this. Please tell a friend. And if you have any questions, please feel free to DM us and we'll produce any of the research. We will gladly continue to talk about it. But I think it's time. And I hope this proves to a lot of people that SARS-CoV-2 is most likely transmittable through aerosols. It's airborne, people. And hospitals need to be taking those types of precautions. They should have been taking those precautions a long time ago. And I hope they make the change to that. And I hope that all the healthcare workers are provided masks because it's starting to get ridiculous. Because I don't know how you're supposed to fight this thing if you're not taking every single precaution possible. So it's extremely difficult. I understand if you've been having a difficult time understanding any of the things going on. It's really difficult for me. It's hard to even understand. There's things that come left and right, and everything changes daily. So I just suggest to kind of stay aware. You're gonna have to kind of keep up as much as possible. And understand I'm not trying to fear monger or anything that everybody's gonna die and it's the apocalypse, but I'm just saying, I mean it's a novel virus. Humans are not immune to pandemics, so we really need to be doing everything we can to prevent the transmission and spread of the disease. So stay activated, y'all.